Cancer patients deal with a lot of pressure and fear. Some are also fighting not to pay thousands of dollars for possible life-saving treatments. It's the case for 43-year-old Sophie Djeme-Mi Koumazock, who has 4 young children aged between 3 and 13 years old.
J'ai 43 ans, 4 jeunes enfants. J'ai un cancer métastatique et je veux vivre.
Sophie was diagnosed with metastatic breast cancer in May 2025. For a year, she was taking an oral medication that suppressed the disease, but that stopped working. Her doctor then suggested an alternative treatment called TrueCap.
When it's the medication we are giving stop to be good and we lose the control, we have to change the treatment. And it's sometimes what we have to do, and it's the thing we have to do now.
Ce médicament peut me permettre d'avoir une bonne qualité de vie, peut-être même de freiner, peut-être d'endormir la maladie. Je veux vivre.
The issue is that her insurer won't cover the medication. She works for the Canadian Food Inspection Agency, which falls under the federal government's public service healthcare plan, which is provided through the private company Canada Life.
C'est une question de temps. Ma fenêtre thérapeutique est petite.
In a written response, Canada Life says the federal government determines what is covered under their benefits plan, including any differences from what may be covered under Quebec's RAMQ insurance. The Treasury Board of Canada, which manages the federal government's policy, says it's not required to provide the same basic coverage as RAMQ, which does cover the treatment under specific criteria. It says the Public Service Healthcare Plan is a Government of Canada-sponsored optional healthcare plan. Although a drug may be covered by the Régie de l'assurance maladie du Québec, the RAMQ, this does not mean it is automatically covered under the PSHCP, as the plan is not required to provide the same basic coverage as RAMQ. Without coverage, she would have to pay nearly $12,000 per month for her treatment.
Je devrais en ce moment me concentrer sur guérir, me concentrer sur ma famille et pas passer de 8 à 4 à trouver des solutions pour me faire soigner.
She is not the only one in this situation. Nathalie Sanson has managed to get the treatment covered through her partner's private insurance with Manulife and the drug manufacturer AstraZeneca. But it took months.
J'ai eu des mal de tête, des migraines, de l'anxiété. Je veux pas que ça arrive à quelqu'un d'autre pour avoir passé ce que j'ai passé au travers, là. C'est inacceptable.
All the burden is shifted on the shoulders of individuals to make the contestation, hire a lawyer, put together a file, and potentially even get expert evidence. I mean, this can be a significant and costly process.
Sophie has now been added as a beneficiary on her partner's private insurance with Beneva and is waiting to see if they could cover the treatment. CBC News asked RAMQ if it would cover the cost of the medication if her partner's insurance also refuses to pay. In an email statement, RAMQ did not answer if it would cover the medication, but pointed to the fact that private insurance provided through an individual's partner should be able to cover the costs. They say it is very unlikely that 2 different insurers refuse to reimburse a medication that RAMQ would accept to cover. In the meantime, she has decided to start paying the treatments herself as they wait.
J'ai 4 jeunes enfants, je dois rester debout. Je veux rester debout.